Hello again. In this session, we'll finish the Chinese medicine dermatology diagnose. So far, probably you'll find there's so much so many things to remember. Uh, but um, try to remember them. In Chinese medicine and also in Western medicine, remember as much as you can is really helpful for the future practice. Now let's continue our inspection. Inspect hair and the nail. Hair and the nail also belong to the dermatology. The hair condition, one of them is the hair loss. That's common in the clinic, at the clinic. Very often people come and tell you about this. Sudden patched loss, hair loss, and this I've seen a few actually. We'll talk about this later. The skin is smooth and pink. These conditions often lead due to blood heat with wind. Thin, dry, and soft hair, sudden or gradual loss. It's related to blood deficiency produced wind. Hair lost and not growing back, relate to blood stasis. Hair broken and or pulled out easily. Skin has yellow crust or white scales. It can be seen in a fungal infection and some other skin problems. We'll mention it later. Young and white hair. This is different from Chinese, Asian, Arabic people, and the Caucasian. In the Caucasian people, young people gradually have gray hair turn out. It's common. People often don't feel it's a problem. But for the Chinese and Turkish or Middle East people, if you're young and then there's a lot of hair turn to white, and then it's blood heat related. White hair after life event, that's very special. It happens. I did see this happen in my lifetime. It happens after sudden life event, like this woman all of a sudden lost her husband. The husband's dead in a car accident or something like that, and then the woman's hair can turn to gray or partly gray overnight or very in short time. It also commonly seen in the Chinese literature in a novel. This often relates to the liver stagnation, weak long-term illness, gradual white hair. It's related to the deficient liver and kidney. Too much hair. I did see patient came to me about too much hair, but in Chinese dermatology literature, it's not commonly mentioned. There's not so much treatment or diagnose discussion about too much hair. And then we inspect whole body, part hair, abnormal hair grow at certain body part, small amount of hair, have little hair from childhood. It can also some hair conditions. We're not going to talk about a lot about this because it's rarely seen, and also it's not very much mentioned in our literature and textbook. Another inspection is nail, and also nail is part of dermatology. Thin and soft nail often is due to qi and blood deficiency. Thick nail often related to the toxin invasion, such as fungus. Dry and easily broken nail, it's often due to yin deficiency plus blood dryness. Shape twisted nail often relate to the qi and blood stasis. In the inspection, the biggest part, one of the biggest part is inspect tongue. We learned all of this in the Chinese medicine diagnosis in general. It's a big part, has a lot of content. I'm not going to be repeat here. Olfaction is one of the 4 Chinese medicine diagnosis methods. We've learned in the general Chinese medicine, and then the inquiry. Inquiry is very, very important. We normally get general information first, like age, gender, and all of that, and then the history. Often patients tell you their present history first. They tell you what's the reason they come to see you. And then you need to ask the whole picture of the current condition, like how it was started, what's the development like, what can make it worse, what can make it better, what are the symptoms, any itchiness, any burning pain, and then what treatment has person approached before and used before, and what are the results. It gives you a whole picture of patient's condition. And then we need to ask the previous history, past history, because a lot of the current condition is previous condition related. Very often, the new graduates don't think about the connection between previous condition and the current condition. For example, if the person have skin condition but previously has uterus or ovary removed, there may be some connection there. Sometimes people ask past history, mainly ask, have you had this condition, skin condition, like eczema before and this and that, but never asked other conditions, or patient mentioned to you, you don't pay attention to it. It is lack of experience, I think. Very often, past medical history can provide some information to us. Even the person tell you, oh, my tonsil was removed when I was young, I sick all the time, and all of this also give you a background about the current condition. Family history is very important. Some skin conditions are running in the family. This is in the gene. This condition is harder to treat because it is in the gene. That's really hard. Personal history, we also need to ask, like special hobbies, special habit. It can be current skin condition related. Say if this person has a hobby, go to swim every morning, later on develop the dryness or allergy or food fungus infection, tinea, and they all related. And then we need to ask symptoms. Symptoms, I want to specify a few symptoms here. It's specifically important for dermatology. First one is itchiness. Itchiness is always disturb mind, disturb spirit. We have to remember this. When we treat itchiness, very often we add some mind calming herbs because itchiness often wake up the patient in the middle of night, especially babies, children, and then they'll cry. So when we treat itchiness, often we add some mind calming herbs, so to achieve better result. Itchiness often relate to wind. External wind itchiness often happens after exposed to wind. Internal wind itchiness can be caused by blood heat, blood deficiency, blood stasis, and blood dryness. Always ask whole body condition. See if there's any blood heat symptoms, blood deficiency. We need to think about all of this. Cold-related itchiness, it starts after exposing to wind cold or cold sweating. For example, some people do sport in the winter. They wear little clothes and then they exposed to wind cold. They have a lot of sweating and the sweat turn to cold very quickly. And then after that, skin's developed rashes, itchiness, and then it's relieved once the person come into the warm room. So there is cold related itchiness and heat related itchiness. It can be released by exposed to cold. Now, dampness related itchiness, it has watery exudate and often appears on lower part of the body. Parasite or insect related itchiness, we find out the reason from history. Toxin related itchiness, like fungus infection, like the tinea condition. We often can find out exterior contact history. The itchiness will be relieved after remove the toxin. Allergy-related itchiness after certain food, the itchiness appears, or after medication, or after some kind of touching some chemicals or touching something. Another thing we need to mention in dermatology is ask pain. Hot pain indicate heat. Stagnant pain often appear as stabbing pain. Stagnant heat often, sorry, there's a typo here, often appear as stabbing pain. Next one's ask about numbness. Patients often tell you if they feel numb. Numbness is normally due to blood flow slow. Loss of sensation is likely due to qi stop moving. Numbness is the early stage of loss of sensation. This other inquiries we should also be included in the dermatology diagnosis, such as our 10 classical questions. That's the inquiry, and then palpation. Palpation is one of the fourth diagnosis method in Chinese medicine. In the dermatology, we can palpate the rash if it feels hot or feels dry, feels cold or feels normal temperature. We do the palpation as much as we can. It helps our diagnosis anyway. But if it's very obvious you can diagnose without palpation, then you decide by yourself. Now, I quickly mention some treatment things for the Chinese dermatology. It's probably more specifically dermatology related. very oftenly for skin conditions, we use internal treatment. Um, it aims at harmonize 脏腑、气血, meridian and collaterals, 经络, expel the 6 pathogens. External treatment is a specific thing in the dermatology as well. External herbal treatment. We use herbs to stop the itchiness, reduce the redness, stop the exudate. We also use acupuncture, moxa, cupping, ear acupuncture, 7-star needling, pricking to bleed, therapy as external treatment in the Chinese dermatology. I listed a few commonly used external itchiness stop herbs. There are some herbs actually it's not allowed in Australia, so I won't read them, go through them one by one. I think you can stop the video and have a look yourself. Unheat eliminated herbs here, drying herbs for the exudate and moist surface, and insects and parasite killing herbs. Remember, a lot of these herbs, like qingfen, liu huang, they're not allowed. Xiong huang, chan su, they're all toxic and not allowed to be used in Australia. So I only list here to broaden your knowledge. Don't be encouraged to use them. I'll mention other external treatment when I talk about the individual skin problems. So I think the Chinese medicine dermatology diagnose talk is finished now. I hope you learned a lot. I didn't talk a lot because English still is my second language. Sometimes I still feel not so confident to use English to express myself freely. So I hope you pay more attention on the knowledge and learn something from my talk. Thank you now. See you next time.